Types of Hallux valgus, there is actually multiple debate on what exactly how to classify Hallux valgus. One of the way was to actually classify on the basis of angles which have been disturbed. Other way was actually given by Pigott et al. And according to them, there is it was actually based on the congruence of first metatarsophalangeal joint. That is, if you see, this is a type A, which is a normal joint. If you can appreciate here, this is the first metatarsal. You can appreciate that the first metatarsophalangeal joint is congruent. That is, both lines are parallel to each other. With there's no lateral deviation of the phalanges as well. This is a normal forefoot, or this is how what happens if there is no Hallux valgus. Then this is type B. If you appreciate that there is slight lateral deviation of the phalanges, that is, the Hallux valgus has started to develop, but at this point you can appreciate that at the first metatarsophalangeal joint both lines are still parallel. This means the first metatarsophalangeal joint is congruent. This is one of the type B of the called as Pigott classification. Now, according to the type C, when the further aggravation results of the Hallux valgus, now this results in incongruous joint. You can appreciate that the lines of the first metatarsophalangeal joint are not congruent. Now, as the Hallux valgus progresses, this progression leads to incongruence of the joint, and incongruent joint means there is increased lateral exposure, increased exposure of the metatarsal head, and eventually leading to more under coverage, and eventually would require disturbed distal metatarsal articular angle and would require some form of a surgery. Now this is another type D, and further you can appreciate that as the convergence is actually divergence is taking place, you can see that this metatarsal head is actually getting uncovered from the phalanges. The more uncovered this would be, the more distal metatarsal articular angle would be disturbed and would require some form of an osteotomy to actually correct it. And as this Hallux valgus progresses, the incongruency starts to develop, and incongruency is actually the main factor which is leading to all the problems, because the metatarsal head has actually gone in plantar flexion and pronation. That is, if this is how expecting this to be a metatarsal head and this is the phalanx, this is how they are united in one way and it's actually congruent. The head goes into plantar flexion and goes into a pronation, while the phalanges are going into lateral deviation, and this is how you can appreciate how much under coverage actually happens. And this means the more metatarsal head is exposed and more biomechanically it's unstable and needs to be corrected by use of an osteotomy. So as the disease progresses from the normal, that is joint, if you can see this type A, as it progresses till type D, this results in increased incongruency of the first metatarsal phalangeal joint. This was one of the classification by Pigott et al. In which he presented it in one of his research article. The theme of this mainly classification was actually to classify Hallux valgus on the basis of incongruency or incongruent first metatarsophalangeal joint. As the disease type progressed, this results in actually increasingly more incongruent joint. And if you can appreciate in this type D, the more incongruent it is, this means there is less coverage, or actually there is under coverage of the first metatarsal head, and the phalanges are more laterally deviated. Therefore, when this will be under coverage of first metatarsal head and more deviation, this would lead to deranged distal metatarsal articular angle, and this means the more higher it is, this means some form of an osteotomy is actually required to bring the biomechanics of this first ray back to normal. Therefore, the increasingly different type it is, that results to increased distal metatarsal articular angle and would require some form of osteotomy. But if it is type B, or which means there is mild incongruency of first metatarsal joint, this means we can go with osteotomy at a different level without really considering the distal metatarsal articular angle.